Good morning. This is my 1 week post-surgery update. It is July 5th at 11:57 in the morning, and I am I think I'm 8 days post-surgery, and so I wanted to make a update on how my health is doing, how my leg is doing, my stitches, what I've learned so far, what has worked for me, etc. So yesterday I got to take a shower after a week of not taking a shower. That was interesting. I took saran wrap after I talked to my physical therapist and got the clearance from him, because you always want to play it safe. I talked with him and he told me to use saran wrap and medical tape. I don't know if he told me to use medical tape, but I used medical tape and just wrapped it around my bandage area so that I wouldn't get that wet. And then immediately after showering, I dried off as best I could, and then I just used scissors to cut the saran wrap off and then changed my bandages out in case any water got in. Let's see what else. Sleeping has been interesting. I think I am stressed, but I don't necessarily feel it. So I've been using 3 pillows, 2 to 3 pillows depending on the night, and a neck pillow on top of it, because I will roll over in my sleep if my neck can move. So I've been using the neck pillow to make sure that my body doesn't feel like it has the liberty to roll over. And it's actually really comfy. I put the 3 pillows, 2 under my back, and then if I really need it, I'll put the 1 under my head. And then that way it just helps keep me upright and minimalizes lower back pain and the like. And also I've been using a pillow that I know, like, masseuses use it and massage therapists, they use it, the pillow that goes underneath your knees and ankles. I can't remember what it's called. If I remember what it's called, then I will try to put that name down in the description, because I want to try and list all of the tools that I've been using so that people can look them up for themselves. I'm doing good. How are you?
Alright, can I get you anything?
No, I'm good.
Okay.
Thank you, though. I've been using the weighted blanket. I got it online. If I can find something similar, I will link that down in the description below, just because I feel like it helps keep circulation in my legs going. Another tip about circulation in your legs to avoid blood clots is rotate your ankles 360 degrees. And so I just lift my foot up, and then I just rotate my foot in a circular motion, and that just helps keep blood flowing down there, so it can limit the possibilities of getting a blood clot in your leg. I've also been using Pressurized Socks. I don't wear them at night because I use the pillow underneath my legs. Oh, that reminds me, the pillow underneath my legs as well helps with the feeling of stretching in my stitches, because the first couple nights when I wasn't using it, I would wake up and I would feel like I've pulled my stitches, or I've pulled a muscle, or the like, and since I've been using it underneath my legs, it has drastically decreased that feeling, and so it just makes sleeping more comfortable. Also, I have been using minimal usage of my crutches, and I've actually been using a walker. I don't know if it's because I've never used crutches before that I find the walker easier, but I find that I can lean more of my weight onto the walker instead of the crutches, which somehow makes it easier. If I'm going up the stairs, of course, or if I'm doing a short walk outside, I will use my crutches just because they're easier than a walker to navigate around outside. And then, you know, to go up the stairs, you need your crutches because you can't put your full weight on it, on your leg. And so I just found that using the walker is easier as well, because with the walker you have a little tray, so to speak, that you can, you know, like put your water bottle on or a book or whatever, and you know, you have a little portable seat that you can stop walking and sit down on if you need it, which in my opinion is really helpful, because I've been walking and all of a sudden my good leg will get really sore or something, or I'll just get dizzy and lightheaded, and so just having that portable seat, if you will, just has made my life a little bit easier. The Iceman has been a huge help because it can have a constant supply of cold air going, and so because the labral tear surgery and osteochondroplasty are so deep in your leg, having the Iceman helps because it sort of gets the cold deep enough, have you will, because I feel like an ice pack thaws too quickly, and then, you know, you only ice superficially. I could be totally wrong on the anatomy, but it's just how it feels for me, and so that's just what has been working for me. So the Iceman has been a huge help in that. Multiple pillows. Multiple pillows help. One, because, you know, you can sleep with them to keep yourself in place. And two, you want to elevate your legs, because 9 times out of 10 you're going to have edema in your operated leg. And I did. And it was kind of alarming the first time I saw it. So then we elevated my leg with multiple pillows, as well as put one under my knee so we didn't hyperextend it. And that helped lessen the amount of fluid in my ankle and feet and calf, and it just made everything a lot more comfortable because edema does not feel the best. And I ended up getting throat ulcers. Not saying that everybody is going to get throat ulcers, it's just what happened with me. And so I've been having to use a numbing spray that I got from Walgreens, just so that I can eat and take my medicine, because all of a sudden a couple days ago it was just so painful that I couldn't even swallow water. And so having that helped me kind of function normally, to where I, you know, could eat soft foods as well as actually drink water. And so I've been using a numbing spray and cough drops to help with my sore throat. I mean, because they said that it could be because of stress, it could be because of I got my top wisdom teeth taken out a couple weeks ago, or it could be because of the intubation tube. And so there's multiple causes that could happen, and so I've been using a numbing spray. It's a bolster, the pillow that goes underneath your knees and ankles. I got a foot roller. It's a little red ball that has spikies all over it. I know a lot of ballerinas use it, and I was a ballerina for a very long time, and so I've been using that to roll out my good foot, so that I don't know, my tendons have been hurting in that foot, so using the ball to roll it out just kind of helps loosen it up and then minimizes cramping in that foot. A lap desk for my computer. That has been very helpful. Just, you know, like little things like that. We've been writing down all my medication in a notebook, so like the times, the dosages, so that we can keep track, and then, you know, because, you know, you're tired, and so actually knowing what you've taken, when you've taken it, just sort of helps keeps things in order and, you know, safer, so in case you forget, like I've been doing. And so my mom has been helping me track things in a notebook, and it's made our life, it's made our life a lot easier, because then we were able to remember medications better. Hi, puppy! I used a shower seat yesterday to shower because my shower is a walk-in shower, and so I didn't really want to bring a crutch with me into the shower because I was feeling lightheaded before anyways because of the heat. And so I just used a shower seat and then just held the shower head so that it didn't like spray my leg directly, even though I had the saran wrap on it. But I used that so that I was trying to keep my leg as dry as possible. So a shower seat has been very helpful in the shower. I didn't use this, but I know some people have it. It's the long handle with the brush, so you know, like you can wash your back and wash your feet. I didn't use that, and I, you know, should have, but I didn't. And so, you know, just for future reference, a handle with a brush with a handle on it. I've been using. It's kind of TMI, but I've been using MCT oil because this is all the parts of surgery. I've been using MCT oil to try and keep my digestive tract moving. So, biggest tip for MCT oil, don't take too much at the very beginning, otherwise you're not going to have a good day. Just heed my advice, you're not going to have a good day if you have too much MCT oil at once. So I've been just using small dosages of that to make sure that things keep moving and, you know.
Mat on the floor.
Oh no, I didn't mention that. I put a mat on the floor so that I wouldn't slip in the shower because, you know, you're only using one good leg and you don't want to put too much weight on your operated leg. So we put a mat on the shower floor so that I could have some traction with my good leg. Yeah, and it'd keep me from slipping, because that would not be fun. And so I'll also list everything that I've put, you know, like for sleeping and walking and daily living and showering and the like. Oh, when I took my bandages off, I had a lot of the adhesive and glue left on my leg, which kept catching on like my shorts or my pants or on my nightgowns or something. And so I got these exfoliating wipes, and I just gently went over my leg with it so that I could get the glue off. And so that is just how I got the adhesive off. I mean, of course you could probably go through it to pass the time. You could probably go through it, you know, just with your fingers and try to pull it off, but I just used the exfoliant side of the wipe and then just scrubbed it off. And everything that you do with your leg is different per person. That's one thing that my PT, physical therapist, told me about, because it's all depending on that person's comfort level. What works for me might not work for someone else, and what works for someone else might not work for me. Hence, I didn't use the shower brush because my leg has been aching, and so I didn't want to bend over, even though, you know, it kind of, but besides the point, I didn't want to bend over and use the brush to wash my feet, and so I just kind of let soap go over them because it was just all based off comfort level. And so you know, you want to stay as comfortable as possible. You want to be patient with yourself, and believe me. Yes, safety rails. I have a very hard time being patient with myself. So that is key to any recovery, is learning to be patient with yourself. And so just things like music and meditating and reading and watching movies or whatever can help. My non-skid socks with the sticky on the bottom so you don't slip. Oh, and safety rails. The safety rails in the shower. I mean, you don't have to get those installed because I mean, if you bring your crutches in there, you can, use that. Or if you have a walker like I've been using, even though they're not entirely waterproof to my knowledge, you can use those as the safety rails, the handles, which is what I used when I got up out of the shower, because you can lock the handles on the walker like so. You can lock them like that and then unlock them. So that's a big help, especially when I'm climbing into bed. That's another good point. Climbing into bed. First couple days, have someone help you lift your leg up. Do not use your own body weight to lift your leg into bed, because you're not supposed to flex your psoas after you've had this specific type of surgery. You want to keep it as relaxed and neutral as possible. And so having someone else lift up your bad leg, if you have to elevate it, because of edema or whatever, have someone else lift it for you. For if you're on your couch or if you're going to bed. I can't stress it enough. Have someone else lift it for you. And then per comfort level, you can start lifting it yourself. Do not flex your leg, but you can lift it yourself per comfort level. I tried doing that, I think a day or two too early, and it hurt. And so I've had people, even though it can seem so helpless, but like I said, you have to be patient with yourself. You are recovering. So things like that, just to help speed up your recovery as much as possible and ensure your recovery as quickly and safely as possible. So just play it smart, play it by ear, play it by comfort. Don't rush yourself. Don't try to convince yourself that you're not in pain. Like, really listen to your body. And I know it's easier said than done, believe me, but it's a lesson I'm still trying to learn myself. If I'm going outside, of course, I'll put shoes on. I'll have someone else put my shoes on so that I don't bend my leg too far. And so, just things like that. Go easy on yourself. Don't push yourself too quickly. You'll have time to push yourself at PT and, take your doctor's advice, take your physical therapist's advice, just be mindful and be smart with yourself, because anything that you do is only going to prolong your recovery and or put you back in surgery, and nobody wants that. Maybe you do, but it's not ideal. So I hope that these tips helped you if you or a loved one is going to be having surgery. I will list everything that I've been using down in the description bar, and then maybe a brief explanation as to what I've been using them for. So that would all be written out so that you were able to, do some research and shopping yourself if you are so interested. And so if you have any questions, comments, concerns, my social media is down below. Please don't hesitate to contact me or ask me questions, but of course, always talk to your doctor, because I am not one. And I wish you a very splendid rest of your day. Bye-bye.